All right, well, good afternoon, everybody, and thank you all so much for joining us today for this debate that's going to look at the Sustainable Development Goals and more specifically how to invest for impact in global health. We will look at the partnerships, the platforms, and the different approaches that are needed to accelerate progress on global health. And for those of you who have read Hans Rosling's new book, Factfulness, will know we've had over the last 15 years the most profound improvement in the human condition ever. More people than ever before have lifted themselves out of poverty, and we've had the greatest reduction in maternal deaths and in child mortality as well. But the job is only half done. But we luckily now have the Sustainable Development Goals, the North Star, that we're all striving towards in the hope to leave nobody behind. So joining me on stage today, we have from the furthest right, Tormod Simensen. He is Senior Manager at Gavi, the Global Vaccine Alliance, where he's responsible for relations with Nordic donors. For those of you who don't know, Gavi brings together the public and the private sectors with a shared goal of creating equal access to new and underused vaccines. Oliver Schulz is the Secretary General of Läkare Utan Gränser, or Doctors Without Borders in English, or Médecins Sans Frontières, or MSF as it's commonly known. Congratulations on your new job. You've just taken over that. We wish you much luck as you embark on that. Next, we have Susanne von Wechter. She is responsible for Nordic donor relations at the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And last but not least, we have Mirja Sjöblom, who is Senior Economist at the Global Financing Facility, which is a multi-stakeholder partnership that is helping countries tackle the greatest health and nutrition challenges affecting women, children, and adolescents. What we'll do today is we'll have a couple of rounds of quick-fire questions and answers from our panelists, but we are all here also to learn from you. So we'd very much welcome any questions, comments, or thoughts that you will have from the audience. But perhaps to kind of kick us off, I'll turn to you, Tormod. Gavi, the Vaccine Alliance, was started in the year 2000. So you're now 18 years old. Congratulations, you're an adult, myndig. What have you achieved in these 18 years? What are some of the concrete outcomes of that work? And how are you contributing to the Sustainable Development Goals?
So thank you, Carl. As you said, Gavi, the Vaccine Alliance, we were established to ensure that children in the poorest countries of the world have access to life-saving vaccines. And the Gavi Alliance, as it says, is really, it is an alliance, it's a partnership. And although Gavi, we fund the vaccines of 60% of the world's children, we have no procurement office. Our friends and partners at UNICEF Supply Division in Copenhagen takes care of that. So basically what we're doing is that we're leveraging each other's comparative advantages to avoid building up parallel structures. So it's really about partnerships in this fact. So what have we been done? Well, basically I've been doing, our business model is relatively simple. What we do is that we group the purchasing of vaccines for the world's poorest countries. We work with the vaccine industry to get the best prices. And we create a market that didn't exist before. And all countries that are eligible for support for vaccines have to pay a small part of the cost themselves. And this is all about sustainability. This is about something that is free is less worth than something that you have to pay for. But mainly, the Minister of Finance has to be involved. The Minister of Finance has to understand that this is an investment, that investing in health is a good thing. And this is very important when it comes to what we call transition. When countries become rich enough to be able to take care of the vaccines themselves, to pay for them themselves, then they are ready to do so. They have a history of funding vaccines. The predictable long-term support from our donors is also extremely important. It is one of the cornerstones. It gives security for the countries themselves as well to invest their own money in their health system and building up the health system, because it's the countries themselves that immunize their own children. It's not us that goes out and build out any parallel structures. When when you immunize children, you will ensure that they don't get sick, and if they don't get sick, their cognitive capacities get better. They learn better in school, and they help build up the country and help the development of the country. Also, when parents don't have to spend their own money on healing a child that is sick, they can spend the money on something else to help grow their own economy. So it has a larger impact on that. And to round it all off, some big numbers. Since we were established 18 years ago, Gavi has funded the immunization of 700 million children who otherwise would not have been immunized, which has saved the lives of 10 million people, the population of Sweden.
Thank you, Tormod. And just a follow-up question there from me. One of the big sort of buzzwords and something that is talked about a lot are public-private partnerships, or PPPs. It's something that a lot of people talk about, but few people do. Sort of like reading a book a week. We all want to do it, but few actually manage to do so. But you guys actually do that. And how do you do it? And what makes you successful where others are not?
So one of the things that we do, I talked a little bit about shaping the market. So we work with the vaccine manufacturers, that's private sector as well, to develop the right kind of vaccines, but also to get the best price and also a secure supply of vaccines. But lately we've been working more and more with the private sector to overcome the biggest challenges that we have. So a couple of the things that are really difficult in getting vaccines out to children is supply chain. How do you keep a vaccine cold from the central storage and out until it comes to the child that it might be further away? Well, there, for example, we're working with a company called Zipline in Rwanda. We're testing out drones, how to deliver vaccines by drones. How do we get people and girls to come and immunize themselves against cervical cancer? Well, we work with Girl Effect to create awareness and a demand for this vaccine, so they come in and immunize being immunized. So we work a lot with private sector on developing new and innovative ways of reaching out to children. Yeah, no. Nah, no.
Maybe we can get it up on the screen here. It might be good.
And what is also very interesting is some of our donors, including the Gates Foundation and the government of the Netherlands, is that they've established a matching fund. So when we're working with the private sector, we're costing it, and they match the contribution, they make it double. So it doubles the impact of it. So it is really an innovative way of doing it. And of course, private sector, we accept cash contributions as well.
Great, thank you. Let me turn to you now, Susanne. The Global Fund is one of the giants when it comes to global health. You're accountable for 20% of all the AIDS financing globally, 50% of all the malaria financing, and a whopping 65% of all the tuberculosis financing. Taking these three big diseases that you fight in turn, and perhaps starting with HIV/AIDS, it's now 35, almost 40 years since AIDS was first clinically observed and the world's attention turned to AIDS. Where are we now? How is the fight going against HIV and AIDS? Have we managed to turn the tide?
Thank you. First, I wonder if there's anybody who's following the game.
What game?
If somebody is, can you just please tell us if it's 1-0 or not? I would love to know. 0-0. Okay, good. So we have, we're not going to talk the whole time.
Here.
Yeah. Anyway, thank you for being here, because obviously something else is happening outside. So the Global Fund was created, as you were saying, just about the crisis of HIV/AIDS, also tuberculosis and malaria, that in total cost more than 3 million lives around 2002. So it was a huge kind of challenge that we don't talk about so much today, but at that point that would have really been one of those priorities, crisis, that everybody were wondering, what are we going to do about it? There was a lot of noise, luckily, from the civil society, from people living with the diseases, especially in Africa, Southern Africa, massive movement there, because the question was not at that point so much about what can we do about it, because since '96 there had been actually the ART. So we did have something that was achievable for people, but instead people were actually dying. So it was actually an issue about injustice. So 2002, the global leaders of the world, civil society, private sector, Gates, among others, all got together and said, we need to do something. We need to do something not with millions, but with billions of dollars. and get a new kind of financial mechanism working with the partners that already exist. So the Global Fund was created, and at this point now, when we were about 16 years old, we've done quite amazing results. I'm saying we, it's not the Global Fund. We are kind of financing the fight. It's a partnership in country level, led by the countries, the government, Ministry of Health, together with Minister of Finance, Minister of Education. I see a lot of colleagues from UNICEF sitting here, WHO, private sector in the countries, and very importantly, people living with the diseases. They have to sit together at the countries and decide together what to do with the investment, because you're saying indeed it's a massive investment that we have been able to do. And in terms of the results, so if I start with malaria, this is probably the...
1 million people die a year, many children under 5.
Yeah, and now we're seeing something that was incredible. You actually have not just Global Fund, but the partnership in the countries where Global Fund works, which is about 130 countries now. The mortality rate has been cut by half, so 50% less mortality. And for children that's under the age of 5, it's 60%. And I'm sure that's something that UNICEF has been working very hard to. It's something that we're all doing, but this is for malaria. With HIV/AIDS, something I worked very closely on 2002 when Global Fund was created. We now have, from having more or less, not zero, but in a lot of the countries where we worked, 11 million people are now receiving ART. Totally is about 19 million in the world out of 38, 39 million people who has the disease. So that's quite amazing what has been achieved.
Yeah. And tuberculosis?
Yeah,
so 10 million people a year get tuberculosis. Basically, the population of Sweden gets tuberculosis.
Yeah.
How's that fight coming along? How can you reach those 4 million or so that currently we can't get to right now?
I think because we've done so great in the other diseases, tuberculosis is much less investment and much less political pressure on that. There will be a high-level event in September in New York, so we're really trying to get much more engagement around that. That's really not... The Global Fund is the biggest financing internationally, but mostly the funding comes from domestic finance, and it has to be. But we've seen much less research in tuberculosis, and we are not really hitting the SDGs at that, so we need to step up on this one.
Great. Let me turn to you now, Oliver. The Médecins Sans Frontières, or Läkare Utan Gränser, is a slightly different organization compared to the others that are here on stage. You're more of a humanitarian organization as opposed to a development one. You work a lot with actually bringing the vaccines to that remote village or to those places where it can't be reached otherwise. You work a lot in research and development, of course, and you also work to make sure that the prices of vaccines are kept at a lower level. What makes your model successful? Why is it you've had so much success over the years?
Well, I think the success of Médecins Sans Frontières, or MSF, is kind of based on two legs. One is the emergency response, and that is what MSF is mostly known for, that we are the first ones in and sometimes even the last ones out when it comes to natural or man-made disaster. But another part or another leg that MSF stands on is this innovation, is trying to deal with these very frustrating situations that we often see in the field. For example, if we look at HIV/AIDS, it's a disease that for a long time in the 90s and early 2000s, people said you cannot treat that in an emergency situation. It's a lifelong treatment, and it is very difficult to get this medication to people, and we don't know if they will continue taking them. And it was MSF who pioneered and experimented and took the risk to see how can we treat HIV/AIDS in places like the Democratic Republic of Congo during a conflict situation and other places. And also tuberculosis is one of the diseases that we have been advocating for a long, long time. There's, since 50 years, perhaps 2 medicines who were developed for that. There's not been much research and development, just like you said. And this is also something that MSF feels strongly to push. And in the end, for us, we work in places that are very difficult to reach. We try to go to very remote settings, to very vulnerable people, where the supply chain is sometimes very difficult to organize. And the more it is important for us that there are structures and that there are products available. And we are quite happy that there is the Global Fund, that there is Gavi, because that gives system and that gives products to the people in need. However, many challenges come with it as well, of course.
So MSF were one of the absolutely critical players back in 2014 when the Ebola outbreak hit in Guinea, Liberia, and Sierra Leone. Do you feel the world is better prepared now for whether it be an Ebola outbreak or some other pandemic disease? Have we learned from that disaster?
Well, I would hope so, but unfortunately it runs with my job to be slightly pessimistic and pragmatic with times. I think we see that some mechanisms are working. We had an Ebola outbreak also this year in the Democratic Republic of Congo, and there were players, MSF reacted as well, so it's good to see that. But it's also interesting to see that it hardly made the headlines. And while it's these big outbreaks, SARS, Ebola, etc., that people talk about, every single day there are many other outbreaks of cholera, of meningitis, of measles that kill many, many people, but they don't make the headlines. And that's still a problem. And while we can deal with the big Ebolas where money pours in, actors come in, the whole show starts working, it's a much bigger problem for all these forgotten crises, for all the forgotten outbreaks of diseases that are not possible to be managed by one organization, even MSF alone, and where we also need other partners to come in.
Great. Well, that's a great opening then for a new actor, fairly new actor, to come onto the stage. Mirja, the Global Financing Facility is the sort of the new kid on the block. And just like with that famous boy band, it got a lot of excitement. And the development community is very, very excited about, with the Global Financing Facility. But perhaps not everybody in the room knows about the Global Financing Facility. So what is it, and why is everybody so excited about it?
That's a really good question. So at the end of the MDG era, 2014, 2015, countries and the global community was looking at what we had achieved well and what we had achieved less well. And what came out of that process was in the health area that we were performing pretty well on the disease-specific goals. A lot thanks to players here, Global Fund. It's been very important there. But on MDG 4 and 5, related to maternal and child health, the global community and countries were not achieving as well. And they sometimes say that maternal mortality, if you have low maternal mortality rates, it's a good proxy for how well your health system is functioning. So there was a recognition that there was a problem here. At the same time, there was an estimation being done. If we were to scale up services for mothers, children, adolescents, and babies, how much would that cost? And it was estimated that to scale up services in developing countries, it would cost about $33 billion. So that's about 80 krona, I think, per capita, which is, it's quite a bit of money. And I'm mentioning this number because I think it's important to recognize the financial challenge. So the Global Financing Facility was created to end preventable maternal, child, neonatal, and adolescent deaths, but doing it in a very different way with a new model of financing, where we recognize that official development assistance is not enough to cover this gap, but you need to work with the ministries of finance, as Tormod mentioned from the very beginning, not just to include a budget line, but also to help them to raise taxes and do it in a much more efficient way so they can start to finance these services themselves, to work and leverage money from World Bank and other concessional financing, to work with external partners such as Sweden or Denmark and the Netherlands and make sure that their financing is aligned to the priorities of the government in this area, and also to mobilize private funding, so private capital. So that's basically what we work on in the 26 countries where we are currently active.
Great. I mean, one of the reasons was why we as the Bill and Melinda Gates Foundation were so excited about the Global Financing Facility is that it's country plans driven by the countries themselves. So I'm just wondering if you can give us a little bit of a sense or some example of a country where you're seeing particularly promising results and where that sort of game-changing model is really coming to bear.
Sure. So I think a country where I have worked myself quite a bit is Mozambique. And there was a financing mechanism there before, but there was a lot of issues with accountability for this money, and they were not spent in a way that donors felt comfortable giving money. And also, we didn't see that much results in many areas, such as nutrition, and also when you look at a very important area, such as reproductive health, there were quite weak results in the last decades. So we started to work there about 2 years ago, and it was really, I mean, we always work in partnership with the big UN technical agencies, with the, as I was mentioning, with the bilateral donors, and what, similar to the Global Fund, putting the government in the driver's seat. And what I would say in Mozambique, what was really interesting was that they developed a very strong investment case. Normally, you know, they have a national health strategic plan, which is sort of a dream list. Okay, this is what we would like. But what we helped them to do was to look at, okay, how much financing do you actually have available from your Ministry of Finance and from the external partners? And then see, okay, what is it that you, if you have to choose, what are you going to pick to finance? And then empowering them to hold that dialogue with all the partners, and then aligning financing behind these priorities. And as a lot of partners were leaving the pooled funding, and this was very problematic because it increased fragmentation in the sector, we worked to set up a mechanism that is much more focused on results, that uses the expertise of the World Bank, which is a key partner, and they're very strong on public financial management to see that resources are actually achieving what they are supposed to achieve. And now several partners have come on board to develop, to finance this investment case. This includes the Netherlands, yeah, I mean many partners, most partners in the sector. Yeah. So it's a very strong program driven by the government and with very clear results.
Well, great. It looks like things are coming on pretty nicely. We have some great examples of models that are working well. We have some great results. We have some good partnerships. But surely there are some challenges too. I mean, it's a little bit overly rosy and optimistic. Tormod, surely there's some challenges too. I mean, just looking at the newspapers these days, there's a lot of aid skepticism. People talk about corruption, a lack of monitoring. Oxfam, one of the biggest NGOs, was just kicked out of Haiti. What keeps you up at night? What are the worries from your side?
Well, obviously, anyone working in development encounters misuse. And so do we, so does everyone else. The important thing with misuse is that sometimes it could be that money that was destined for something was used for something else. That is also misuse. But you know, sometimes it's also just stolen. So therefore, it's very important that the institutions that work with on development have a set of measures to both prevent, to detect, and also deal with misuse cases. And so far, we've been working very closely with our partners, Global Fund, with UNICEF, WHO, the Swedish embassies, and other embassies, and we've been pretty good at recuperating misused fund. Another issue that I would say keep me up at night is the issue of transition that I talk about. That when countries become rich enough to be able to take care of, to pay for the vaccines themselves, will they actually put the money in to vaccines? That's a very important question. And will they be able to pay for the vaccines as well? Will they put raise the money for that? And here it is extremely important that we work together with the politicians to ensure that the political leaders in the countries that transition out of our support keeps investing and put health as a core measure. For example, if you invest $1 in immunization, you get $16 in return in savings.
Pretty good investment.
An amazing investment. I think your boss said this is the best investment he ever made. It is critical. And finally, there's still 1.5 million children that die every year due to vaccine preventable diseases, and this is way too much.
A quick follow. How do you deal with the whole issue of monitoring? How do you think about that and account for that and mitigate that issue?
Well, for example, if funds that we've been provided to a country has been detected as misused, we find out what kind of misuse it is, and let's say it's been stolen, which is, of course, the most serious part of this. A whole set of measures are set in, and the country would most likely prosecute the person and repay the money. We have right now a 99.3% payback rate on money that has been misused, so not only stolen but also misused. So that come back with us. But it is really it's about partnership. It's about working very closely with the Global Fund, for example, on sharing fiduciary risk. We're sharing information about what is happening. Working very closely with the embassies. The embassies are they're on the ground. Our partners are on the ground. They provide us with information on this.
Great. Now turning to you, Susanne, I think you outlined some great progress when it comes to tuberculosis, malaria, and AIDS. But if one looks at some of the studies that are coming out, there are also some challenges there. We see resurgence, for instance, in malaria in countries from Rwanda to Papua New Guinea. There is resistance to some of the tuberculosis vaccines and so forth. What are the challenges that you see from your vantage point?
Thank you. I think if you wonder what keeps me up at night, I would say that it's the fact that 1,000 girls and young women have been infected by HIV/AIDS today in the Southern Africa region. And that's one of those groups, one of the key groups that we haven't been able to reach, and that's, I think, all of us, and that's a lot of investment we need to just re-engage on this. Whether we will do this or not, we'll see, but we have some quite strong targets, like with the Global Fund and with partners, is a 58% infection rate cut within 5 years. And UNAIDS is putting a lot of focus right now on increasing the HIV/AIDS prevention, and Sweden has an extremely strong role in this as well within our board. So I think in terms of the HIV prevention, it's something we really need to scale up substantially as well. Sorry, if I could say one more thing as well. We work with a lot of difficult groups, and in the countries, not the poorest countries perhaps, but when we work with key population, where the epidemic you can have actually quite low epidemic in general, but with some groups, no. That's it.
Great backdrop, isn't it?
I thought they were
got
really excited about what I was saying.
Your point.
Apparently not. So we need to work with sex workers. It's transgender. It's prisoners, for example, for tuberculosis. Adolescent girls and young women in some areas. These are the groups that you really need to get to. And in order to do that, you can't really just work through the health systems. How would you get? Transgender is afraid of entering a health center because they will be mistreated. So we need to be much better at working on gender equality, on the abuse of human rights. So that's a lot of new focus now for Global Fund and partners.
And on the other disease that you had mentioned that you work a lot with, on tuberculosis, with 10 million people infected every year, but 4 million of those not being reached. How do you cope with that? How do you manage that challenge?
I think just knowing is already a start. The fact that we know that we are not reaching 4 million people. So that's something we need to do much smarter. For example, I know there's a program in Tanzania right now that's looking exactly how do you find the missing cases of tuberculosis. So they work with whatever partner they can work with traditional healers who are the first one you would go to and who learns how to do the sputum sample. So try to look at all this kind of community outreach, because we won't be able, if we can't get the people to go to the health center, where can we find them?
Great. So Oliver, turning to you now and asking you the same question, what keeps you up at night? How do you make sure that you fill those gaps in the UN system or that aren't filled by other global health actors to make sure that nobody really is left behind?
Well, I think filling the gaps has always been our core activity. But indeed, if I were to think of all the things that keep me up at night, I probably would not be able to sleep anymore at all for eternity. I want to live long enough. No, but it's other things. And I think within this debate, no, I mean, we see already how we shifted from the Millennium Goals to the Sustainable Development Goals. The Millennium Goals were very much health-oriented. Now it has been watered down a little bit. What keeps me up also, apart from all the crises that exist, is that sometimes there's so much nice simplicity by putting systems and structure to things. No, we say result-oriented funding, we follow things up, we make sure that there's a structure, but the reality is often much more complex than that. We know that, as we also said, no, countries that evolve, that basically make school and move on to a middle-income country are not perfect. And myself, having talked to health ministers, finance ministers as well, I know that I sometimes get promised the most beautiful and wonderful things, but the reality looks very different. Working with some of the governments that make choices who gets healthcare and who does not get healthcare is a huge problem. And that can be countries like Syria, can be countries like Ethiopia, Libya, etc., where it is very, very difficult to know, is the partner who's sitting across of the table, the government, actually reliable, or are they just saying this to get the money in and for cosmetics, basically, and in the end, nothing happens. MSF, we deal a lot with structural violence, populations that are neglected or that are structurally not given access to healthcare. And that exists today also in countries where the Global Fund, where Gavi and others are working, and there's no easy solution to this. There's no miracle solution. So I think these are the things. We have these nice systems and we have nice structures, but in the end, if we're not fundamentally patient-driven, fundamentally community and beneficiary-driven, then we lose out. And in the end, all the structures will not help us if we are not looking at what is actually needed on the ground. If we are looking just at how much money a donor can give, how much money we can raise in order to have these things, but not how much money is actually needed by the people on the field, then we're missing out on the most fundamental rules of engagement.
Those are great sort of challenges and tough ones to tackle, but I know you're working hard on them at a political level, at a systems-wide level. How about some of the challenges you also face at a technical or medical level? You know, multi-drug resistance, tuberculosis, for instance, that I know you work with the Global Fund on. How's that challenge coming along, and how do you see that progressing over the coming years?
Well, it is a challenge in itself because it is so difficult to treat, and the treatment itself is difficult for the patients. Overall, I think most of the bigger challenges we see is availability of drugs, is the cold chain, as was said earlier as well. But also, if we look at the bigger systems, countries that previously got their drugs through international systems, the GDF, for example, and are now shifting to a national procurement, we're not sure how are they actually procuring the drugs. Is the money being used in the right way? Are the right drugs being ordered, etc.? MSF, for a long history of time, had to advocate strongly for right use of medication. In the malaria case, for example, to use Coartem instead of chloroquine or older drugs that were procured by countries. So we also know it's actually good to have these international systems, to actually have some oversight, because handing over too early can actually turn a middle-income country into a country that is less or provides less quality of healthcare than a lower-income country that gets all the support by the wonderful partners that are standing on the stage.
Great, thank you. Now, let me turn to you, Mirja. You mentioned earlier in your response that one of the things that you're set up to do and that you a little bit grapple with is the whole issue of fragmentation, to make sure you don't get a fragmented global health system. So how are you approaching that to try to bridge that and make sure that there's less of fragmentation, ideally eliminated over time?
So for those of you who works in the health sector, I'm sure you know that there are a lot of players. And I was speaking to the Minister of Health for DRC some time ago, and I remember he mentioned that he was dealing with, I think, 10 multilateral organizations, 15 bilateral donors, and over 100 NGOs. So you can just imagine how difficult it is to steer that ship in the right direction. And what our approach to that is to provide flexible funding to governments to be able to help them with that job. And then there's also on our investors group, we have most of the big players in global health, the UN agencies, Gavi, Global Fund, and private sector is represented, CSOs, and they sit on our board. And this is also a very important partnership to be able to bring issues that are happening at the country level to the global level and put pressures on partners to align behind the priorities of the countries. And in the case of the GFF, we support countries to develop these investment cases where they define their priorities and then work with countries to develop mechanisms for them to be funded. So as I mentioned before, yeah.
Great. I'll open it up to questions and comments from the audience shortly. But just one quick follow-up question, and to build on something Oliver mentioned earlier as well. In terms of empowering governments to then take charge of their own global health priorities, and it's something you work with very closely, how do you make sure that governments prioritize health? They have all these different priorities that they look at as a government. Of course, you're very interested in the health aspect. How do you make sure that you drive home that point and make sure that it really is top of the agenda?
Yes, so I think it's very important to, from the very beginning, look at the financing situation in the country and talk to the Ministry of Finance. Why are you not, if it's the case that they're not financing their health sector, why is that? In many cases, they would answer, well, we don't think that the sector can absorb more money. We don't think that they can spend the money well. So I think sometimes it's about working on improving efficiency in existing resources. But it can also be that they are not very aware of the importance of investing in health. And as Tormund was mentioning, the rate of return on investing in vaccine is huge. Like and sometimes they don't know about that. I think in some countries, in the investment case process, the question of sexual and reproductive rights have been put at the forefront. And in one particular country, the question about fertility and the importance of providing family planning was brought up with the Ministry of Finance. And when it came to that level, they realized that it's actually not just a question about providing healthcare to girls, but it's something that will impact the economic development of their country. And I think that's the kind of dialogue that we can have together with partners, and it's also a big advantage that the World Bank is hosting the GFF, because the World Bank normally has a direct relationship with the Ministry of Finance. So I think that is also a big advantage. Thanks.
Great, thank you for that. And now let me turn to the audience here. I think there is a roaming mic somewhere. Thank you, Anna, very kindly. Oh, there it is, I didn't even see it. So we'll take a few questions from the audience and then we'll let the panelists answer. So please, if you could just mention so everybody knows your name and your affiliation and then your question or your comment. Thank you.
Thank you, Cole. My name is Angelica and I work for ALDC Partnership, a partnership that is quite huge, trying to contribute to the work that you are doing from the financial sector. And picking on the traditional capital market, I would also say, so it's really trying to move towards that ship that you were talking about in a brilliant way, as we could see that there needs such an organized way of talking about the indicators. And if I may pick on a couple of things that you've said, we've mentioned the Haiti question, and I've read a report talking about how the indicator of empathy helped the organizing people that were trying to do something good. That could be NGOs or any of them, but it was not happening until we got to this kind of for me, I call it the governance. Okay, it's a kind of organizing in a way that from the financial sector we see as how would you measure and indicate governance, such as when you talk about maternity mortality, that has to do with how the health of the country is functioning. That's how we talk about in an investment area. If the governance is working fine, if there is empathy, there might be a way we can go forward. Now, picking on that word, empathy, how would the panel see your work? And can you judge that? Can you see that? Can you? How do you relate to that word, as we do a lot from decision making?
Great, thank you. I think we'll take a few more. Let me see if there's any other questions, comments. Yeah, I think we're going to hear from Swedfund also, Maria, and then, yeah.
Hello, I'm Stefan Peterson from UNICEF. I think collectively, although we may think of ourselves as big players, I think we represent 0.1% or 3% or whatever it is of the total health spending in the countries that we talk about, low and lower middle income countries. What's your recipe actually to leverage domestic funding and get this higher on the political agenda to actually make a difference beyond the in best case, catalytic funding you can all provide even if you're big?
Great, thank you.
I'm Maria Håkansson. I'm the managing director of Swedfund, which is the development finance institution of Sweden. No go this time either. So I actually have two different questions. I really enjoyed the dialogue around partnerships, and I think that's such an important thing in achieving Agenda 2030. So looking at, I mean, all the successes you have had, how can you replicate your experiences into others? Or the other version of the question is, what's preventing others from being successful in achieving the strong partnerships? And being then a development finance institute, I mean, for us, we are also investing very much in the health sector. And I think one of the challenges is actually to mobilize capital. I think that's one of the bigger ones. And how do you work with that? And what's your view on blended financing? How can you really achieve a good mix between different sources of finance to actually achieve the end goal?
Great, I think we'll take one more question if there is one, and then we'll turn it over to... Okay, so who wants to take any of those questions, whether it be on the blended finance piece, partnerships, or...
I can talk about empathy.
Sorry?
I can talk about empathy.
Yeah, go ahead.
Finance partnerships, I leave to you guys. But the two go together, no? And I think this is exactly what is actually needed, because the more we look at criteria, such as the gross national income, such as the GDP or other criteria, we forget very much the principled part of what actually makes principled humanitarian action so important. And despite it being maybe a small percentage of the aid that is coming, it is that small percentage that goes the furthest way to the most vulnerable of the vulnerable. And for that, I mean, empathy is difficult to measure, but for MSF, it is part of our principles, where we say we want to be patient-driven, and we want to be where the need is the highest, impartiality. No? I do think that it becomes more and more difficult the more we look at financial indicators, the more we look at economic indicators. And I very much appreciate your comment, because in the end, it has to come back to where all the money and the indicators and the structure has to go to, and that is the patient. That is the beneficiary, the communities. And I think we shall never lose sight of that, even if it's difficult to measure and if it's difficult to portray in a report in numbers, etc. It is important to underline that in the end we're doing this for empathy, for humanitarian causes.
Great, yeah, and maybe on the partnership side, I think you, Susanna and Tormod, might be able to say something about that, not least because of the great collaboration your two organizations have, also symbolically sort of encapsulated it with the two of you moving into the Global Health Campus in Geneva, so even under one roof these days. Anything you want to add to that or the other questions? Go ahead. Where's yours?
Well, if I might start, can I start with financing, because I like that. How to mobilize capital. That, you know, it is really interesting, and Gavi has really been in the forefront of developing innovative financing mechanisms. And we have, for example, we're selling bonds on the capital markets to raise money to front load immunization, because then you can spend the money today and you have effects going out into the future. By the way, I think this is a great opportunity for anyone working with climate to use the same model. It is a way to raise money that it's also very interesting, because it helps certain donors to be able to raise money now even if their development budgets are a little bit under pressure, because the money is going to be paid back over a longer period of time, and the interest might be actually less than what they're paying on the country's own bonds. So that is interesting. We've raised money from private sector as well, as I've been saying, and the matching funds. But I know time is running out, and everyone wants to see the second period, maybe. I do. On partnerships. Gavi is all about partnerships, and all our organizations are all about partnerships. But Gavi and the Global Fund, we've been working very closely together lately on, I was talking about misuse and sharing information about that. We're also now aligning more and more what we're doing in countries, and also being here today is about raising awareness and putting this on the agenda. And of course, I have lots of UNICEF friends here in this room, so of course UNICEF is one of the core partners in the Gavi Alliance.
A quick addition to you, then I'll do a final one question answer from the panelists and you as the audience as well, so be afraid.
Well, I would like to say then that leave one no behind.
Yeah.
That's very easy to say, but it's not that easy to do. And one of the things with the Global Fund, and when I was talking about the model of having key populations sitting at the table when we're having a country dialogue about deciding where should this billions of dollars go to invest the challenges ahead, that's not a very easy partnership, and something we are struggling with. We're doing, but it's done better in some countries than in some others, but it's just extremely important part of when we're taking partnership. We do have the private sector sitting there. We have of the UN and the government, but once again, to have also the key population that really are the one affected by the problem, to have their voices when we're doing something, that is, I think, what is really driving success and driving the result, and constantly keep us accountable that we are doing what we're doing. Because if somebody's, sorry, I should keep this short, but if there's an issue around human rights, you will see it directly when you're having this kind of discussions. You talk to the people because they are in the room, and you also have the people from the Minister of Finance there, or the Minister of Health. So you get a really interesting dynamic.
Great, so thank you. And with that, let me just ask the panelists a final question, and you can only answer yes or no. So we've heard about some of the great work that's taking place, the great partnerships, but also about some of the challenges. So my big question to you is, will we achieve Sustainable Development Goal 3 on global health? Yes or no? Tormod?
Yes, I'm an optimist.
Oliver?
I sure hope so.
Definitely an optimist, yes.
Yes, Mirja?
Of course.
And let me see a show of hands for those of you who believe we will achieve the Sustainable Development Goals. Raise your hand. That's pretty close to unanimous yes, which is very positive, of course, because the only way to drive towards progress and to try to attain the Sustainable Development Goals is through positivity. So with that, let me thank you all for being here today, despite other things taking place outside and busy calendars and agendas. And I wish you all a very good, successful next few days at Almedalen. Thank you. Bye.
Thank you.